I, Dr. Ramkumar Srivastava, will tell you about the type 5 diabetes, which is a malnutrition induced diabetes. All we know that diabetes is a chronic disease where the body either doesn't produce enough insulin or cannot effectively use the insulin it produces. Insulin is a hormone that helps glucose, sugar from food, get into cells for energy. So we know that insulin is a hormone which stores the sugar, and when there is requirement of the energy, it will give the energy by storing the sugar. Nearly 75 years after a particular type, that is type 5 diabetes, was first recorded, giving attention onto malnutrition induced diabetes. It was first reported in Jamaica in 1955 and then defined as J type diabetes. WHO classified in 1985 as malnutrition related diabetes. In 1999, WHO removed that, citing lack of evidence of causal association with the malnutrition. Unlike type 2 diabetes, where the global number are largest and which is the most common type of the diabetes, this arises due to unregulated intake of nutrition and consequently results in overweight. Type 5 diabetes associated with undernutrition and even low weight. So there is a difference between the type 2 diabetes and type 5 diabetes. In type 2 diabetes, the patient are a fatty patient and having overweight, while in type 5 diabetes, the patient is lean and having a low weight. Type 1 and type 2 diabetes are both chronic conditions that affect how the body processes sugar, but they differ in how they affect the body's insulin production and use. What is type 1 diabetes? Type 1 diabetes, the body immune system attacks the cell that produce insulin, leading to a complete lack of insulin production. So in type 1 diabetes, there is complete lack of insulin production, while in the cases of the type 2 diabetes, the body either doesn't produce enough insulin or the bodies shall become resistant to insulin effect. The difference between the type 1 and type 2 diabetes: in type 1, this cannot be prevented or cured, while type 2 diabetes can be prevented through lifestyle modification. In type 1 diabetes, the body does not create enough insulin, while in the cases of the type 2 diabetes, the body does not create enough insulin or develops insulin resistance. In the type 1, the causes are unknown, but genetics may play a role. So, this is present in the childhood. While in the cases of the type 2, causes includes genetics, aging, inactivity, obesity, and many more. And this is very common in the adult patient. Type 1 diabetes, this requires insulin injections for whole of the life, while in type 2 diabetes, this requires insulin as needed, injected or oral. Type 1 diabetes. The causes of type 1 diabetes: an autoimmune disorder where the body's immune system mistakenly attacks and destroys the insulin producing cells in the pancreas. So there is a defect in the pancreas. Insulin, the body produces little or no insulin. So there is a requirement of constant insulin intake in the cases of the type 1 diabetes. Onset often diagnosed in childhood or adolescence but can develop at any age. In type 2 diabetes, the cause is that the body doesn't produce enough insulin or the body cell does not respond properly to insulin, and this is insulin resistance. The insulin in type 2 diabetes, the pancreas may still produce insulin but not enough to meet the body's need, or the body cell may not be able to use it effectively. Onset typically develops gradually in adulthood but can occur at any age. But this is most commonly occur after the age of 40 years. What are the symptoms of type 2 diabetes? These are the increased thirst, increased frequency and volume of urination, increased hunger. These are the three main features which are present in type 2 diabetes, while the other features are fatigue, blurry vision, sores, cuts and bruises that are slow to heal, weight loss, tingling, numbness or pain in the feet or hands. You can see in this diagram, these are the symptoms which are present in the type 2 diabetes. How is type 2 diabetes treated? Type 2 diabetes can initially be managed by lifestyle changes. Behavior changes such as becoming more active and eating a healthier diet can help to control blood sugar as well as to lose or manage weight if overweight or obese. So, in the cases of overweight patient, then exercise and diet are the main important part by which you can regulate the type 2 diabetes. When these changes are not enough to manage type 2 diabetes, then you consult the doctor and they will prescribe the medication or insulin therapy. These are some of the complications which can occur because of the presence of the type 2 diabetes. These are the eye diseases, hypertension, skin infection, heart diseases and stroke, kidney diseases and nerve damage. Type 3 diabetes. The type 3 diabetes is a term used in research to describe a proposed link between Alzheimer's disease and insulin resistance in the brain, but it is not a recognized medical diagnosis. Type 3 diabetes, as proposed, refers to the idea that insulin dysfunction in the brain impairs cognitive function and contributes to the progression of Alzheimer's disease. So, in type 3 diabetes, there is a combination of insulin dysfunction which is related with the Alzheimer's disease. Type 3C diabetes, also called pancreatogenic diabetes, which refers to diabetes caused by damage to the pancreas. So if there is a damage to the pancreas, then this type of the diabetes is known as the type 3C diabetes. Type 4 diabetes. Type 4 diabetes is a term used to describe a form of diabetes primarily affecting older adults, often those who are not overweight or obese, where insulin resistance is a key factor. Unlike type 2 diabetes, which is frequently linked to obesity, type 4 diabetes is more closely associated with aging and changes in the immune system. So there is a difference between type 2 and type 4 diabetes. In type 2, this is related to the obesity, while type 4 diabetes is more related to the aging. Type 4 diabetes is characterized by insulin resistance, where the body's cell doesn't respond effectively to insulin, leading to higher blood sugar levels. What is type 5 diabetes? Type 5 diabetes is a distinct metabolic entity. People of this type of lean diabetes have a history of malnutrition in utero and continue to have a low BMI into childhood. Drawing in the thrifty gene theory of diabetes, the thrifty gene hypothesis suggests that certain genes that were advantageous for survival during times of food scarcity in our ancestors, allowing them to store fat efficiently, are now detrimental in modern, abundant environments. These genes can lead to increased fat storage, obesity, insulin resistance, and type 5 diabetes. Professor Hawkins explained about type 5 diabetes that because of the programming in utero, these people have actually accumulated more fat than planned for by the gene. This leads to the thin fat phenomena. Since these individuals never catch up with malnutrition requirements and remains nutritionally challenged as adults, these thrifty genes never kicks in. Countries such as India, Sri Lanka, Bangladesh, Ethiopia, Uganda, Korea, and Rwanda reported such cases, and about 25 million people globally living with type 5 diabetes. Researchers are going in College of Medicine, New York, on early life undernutrition is a potential risk factor for the development of diabetes in adult life. Promote more research and increase awareness about type 5 diabetes among clinicians and researchers globally. It is also suggested that the name type 6 diabetes distinguishes it from other forms of diabetes. What are the suggestions for the type 5 diabetes? Develop education modules to train healthcare professionals worldwide. Promoting research on pathophysiology and management. Defining diagnostic criteria for type 5 diabetes. Establishing a global registry to facilitate global research collaborations. Diagnostic and management guidelines. These are the some of the suggestions which we are giving to the type 5 diabetes. This is all about type 5. Thankful for listening. Thanks.